Good morning. Today, I'd like to share a milestone in our response to this pandemic. In St. Louis County, 70% of our residents have had at least one shot of the COVID-19 vaccine, with 61.8% of our residents fully vaccinated. We continue leading the state in vaccination rate with these promising numbers. Also promising is the continued drop in COVID-19 cases and reports from our hospitals that the number of COVID patients they are treating is going down. Just a month ago, we were in a very different spot with COVID cases and hospitalizations at record levels. But with an expansion of testing, a steady rise in vaccination rates, and continued mitigation efforts, including wearing masks, we are seeing the hold of Omicron substantially weaken. Across the country, we're seeing some jurisdictions announce changes on mask requirements. Last week, Governor Pritzker said the mask mandate for Illinois would end February 28th, allowing for local restrictions to remain in place. Here in St. Louis County, we continue looking at key metrics to guide us in what steps to take next. That includes average daily cases, positivity rate, and hospitalizations. We continue to be in the CDC's high threshold for COVID transmission, but the 7-day average of cases continues to drop quickly. And the positivity rate is also on the decline. We'd like to see the 7-day average below 50 cases and the positivity rate below 8% to get us into moderate risk categories. We'll continue our daily communication with the Pandemic Task Force on the number of new hospitalizations and those who are treating in the ICU for the virus. We are also in regular communication with the City of St. Louis, which has a mask mandate in effect until March 6th. What's different with Omicron is that overall, it's not been as threatening as Delta, but it's much more transmissible, which means that more people did become sick with it, and the sheer magnitude of the variant threatened hospital capacity. We don't want to take any premature steps that would jeopardize our hospitals or prevent our children from staying in the classroom. Despite the warnings that I've continued to share at these briefings, I'm an optimist. We are resilient. We've seen what vaccines and mitigation efforts can do in fighting the virus. So here's my ask today. Stay with us. We're almost there. We just need to keep an eye on this virus for a few more weeks to make sure that these promising numbers hold. And if they do, we can talk about moving from a mask requirement to recommending wearing one in crowded indoor spaces. We know that when mask mandates go away, many of our people will want to continue wearing them. And I think that's a good idea. But people have pre-existing conditions that continue to put them at higher risk, and some are concerned that any new variants might come along. And our youngest children are not yet eligible for a vaccine, so parents and child care providers will want to continue doing all they can to protect them. Masks became political, and that's a shame. They are a simple, effective tool. They give us the freedom to move about. If not for masks, our hospitals would have been overrun. More people would have died from this virus. In St. Louis County, we have lost 3,071 of our residents to the virus. We've not taken on the mitigation steps when we did early on, the number would have been much higher. This has been a long road, longer than I ever imagined. We had no idea back in March of 2020 the persistence of this virus or the variants that it would produce. But now we have vaccines, and our healthcare workers are in a much better place, a much better understanding of how to treat the virus. And we know those mitigation efforts we have urged from early on do work. Avoid crowds, wash your hands regularly, wear a mask, and keep listening to our public health experts. They want what's best for all of us, and we're working every day to make our community safer. Thank you, and I'd be glad to take any questions.
Dr. Page, we do have a question that came in from KMOX regarding boosters. There's been studies showing that the booster immunity does wane over time. Could you share your thoughts on that?
Yeah, the question is about boosters and waning immunity. We know that with this vaccine, over time, the immunity does fade. That's why boosters are recommended, and I would urge everyone who's eligible for a booster to get one. But we also know that the vaccine works. And even if the immunity does fade, we know that folks that are vaccinated are much less likely to get very sick from the virus, to end up in the hospital, or especially to end up in the ICU. So even with waning immunity, we know the vaccines help us a great deal. But I would urge anyone who's eligible for a booster to get one. Any other questions?
That's all we got.
Okay, thank you.